China's zero COVID policy has triggered widespread lockdowns, fear, unrest, and major economic issues. Earlier this week, Shanghai Disney temporarily trapped visitors inside the park after one person tested positive for COVID. Disturbing reports have also emerged in north central China, where an outbreak intensified at the world's largest iPhone manufacturing facility. Workers say they've been forced to flee the factory amid food shortages during quarantine.
And consider this, more than 50,000 new COVID cases have been confirmed in China just over the past week. This is according to Johns Hopkins University, while at least 67 deaths have been blamed on the virus. For more on this, we're bringing in Lawrence Gostin now. He's the director for the World Health Organization's Collaborating Center on National and Global Health Law. He's also the director of the O'Neill Institute at Georgetown University. Lawrence, thank you for giving us some of your insight today. Just spell out for us why Chinese President Xi Jinping will renew his support for this zero COVID policy, despite everything Lana's just run through, the new cases, the unrest, you're locking people up in theme parks, you've got slowed economic growth. Why keep this strategy in place?
You know, it really is perplexing. I actually just came back from Geneva. I saw a number of my Chinese colleagues, and there's a considerable discontent, particularly in academic and other areas of China. I mean, I think Xi Jinping is really just trying to save face. He's just been reappointed as head of the Communist Party, and in his speech there, he doubled down on zero COVID strategy. My guess is that once the party Congress is over, which it is now, that over the next few months, maybe 6 months, he'll gradually relax it. But it's really been a disastrous policy for him personally and for China as well.
Well, another policy that I'm still trying to understand is the issue of COVID vaccinations in China. Beijing still is refusing to approve mRNA shots that were developed in Western countries. That's happening in the context of much of the country's elderly population with a low vaccine rate. Given how damaging the zero policy on COVID is, why wouldn't they try harder to get more people vaccinated, particularly with these more potent vaccines? How can China address this?
Yeah, I mean, you're absolutely right. I mean, Xi Jinping has really made a situation that he really can't get out of. There's deep discontent within China and ridicule outside of China. Human rights abuses, food insecurity. He's using it to track with smartphones every Chinese individual resident, so he knows exactly where they are, all under the guise of COVID. And the only escape route is wide vaccination, particularly among the vulnerable, and wide vaccination with a really good vaccine, like a messenger RNA vaccine, like the ones we have here in the United States. But false pride, false nationalism is preventing him from doing that. He's also doubling down on Chinese-produced vaccines, which really aren't as good as the Western-produced vaccines. And the only way he's going to prevent a colossal problem for the health and safety and security of China is to make sure that there's high vaccination rate, particularly among the elderly, with a really good vaccine like an mRNA vaccine like we have in the U.S.
I mean, what strikes me is your point that President Xi Jinping may be trying to save face by doubling down on these policies, continuing them despite how damaging they are. And, you know, as we've mentioned, this is a single-party state. He's extremely powerful, more powerful now, perhaps, than he was. So what then can anyone else do, the WHO, the U.S., the international community, to protect against the spread of COVID there in China and elsewhere? Can anyone else do anything else?
Well, you know, from what we know about Xi Jinping, and I've studied him, and many times I've been in China dozens and dozens of times, he's really very headstrong, and he believes in the kind of China first, China leading technologies and their policy. And he thumped his chest quite a bit, particularly when the United States was suffering with COVID-19, saying that his zero COVID strategy worked better. It's clearly not working well now as vaccines aren't good. I think that he's waiting for some kind of signal. So, for example, if the World Health Organization were to discontinue the global emergency for COVID-19, that might give him an escape route to actually try to do something about it. As far as US-made vaccines, I don't see him really caving in. But if he was doing it for his country, he absolutely would acquire these vaccines, approve them, and distribute them.
All right.
So
Lawrence
interesting.
Gostin, thank you for joining us, and thank you for all that you do.
Thank you, Lawrence.
Thank you.